living in.
I know.
This is the way
Seriously.
this is the way of human contact and interaction nowadays.
I know. It's so sad.
So all right, so that's all we'll do. So you're good right now? You got a little time?
Yeah, totally, totally.
All right, cool. So we're gonna keep it very casual. Dr. Nick, Dr. Kim having a coffee together. This is our first podcast. I'm doing a little treatment mobily, as you've been seeing through East to West Rejuvenation, but our company is going to be Muscle Fix Mobile. We just fix muscles mobily. So we come to you, to your gym, to your home, wherever you need us to go. And with the new future and the new world we're in, I think this is going to be the way we're going to be treating patients for me, you, and a lot of other people. So I want to thank you for your time and the opportunity to talk a little bit about kind of what you do as a chiropractor and have a couple questions.
Absolutely.
So
Sounds great.
we've been working on and off together for years. And as a PT and just kind of as a non-medical mind, a lot of questions people always ask me about is, what is the crack about, and is it good to get cracked? So two-part question. Everybody likes to hear about cracks. So tell me a little bit more about your very, very educational approach and very kind of like layman's terms, because what I notice as PTs and providers, sometimes we talk a little too sciencey. So tell me about, in layman's terms, what the crack is about, and is it good to get cracked? Hello?
Lost it for some reason.
All right, cool. So again, two-part question. What is the crack, and what is it okay to get cracked, and what age is it okay to get adjusted, or what you guys do as chiropractors?
Okay. First of all, you can be adjusted from birth. We've done that with, I've been called to the hospital to adjust newborn children. And the reason for that is because the birthing process is not as easy as a child just flips out. The doctors have been known to use a lot of force, upwards of 90 pounds of pressure, in order to help a child's head or arm or whatever get out of the vagina during birth.
Right.
So also, it's not as simple when you think about, oh, I just had a cesarean section, so that, they just kind of cut you open and pop the baby out. That's not easy either, because those stomach muscles are so strong, and all the muscles underneath of the uterus are totally, really, really strong. So they literally have to pull that apart and edge the baby out. It's not as easy as just popping them out. So we always like to check the children at birth or shortly thereafter, just to make sure that everything is in alignment, because as you know, you would want your spine aligned, and then the structure, the muscles, to grow strong or to hold it.
Wow.
Right?
All right.
So, yes. So the chiropractic adjustment itself is obviously by, you have to go through training. We're trained specialists, right?
Mm-hmm.
And we do use a controlled sudden force to create that cavitation or that cracking sound that you hear. And the goal of the procedure is to improve spinal motion and to improve your body's physical function. So the adjustment itself, you'll hear the crack or pop. It's really called a cavitation.
All right.
And to remove the restricted joint movement. And this creates a lot of different physiological type of reactions that occur. But the pop itself is just really the release of gases like oxygen, nitrogen, and carbon dioxide, which are in the joint capsule itself. So the joint is a live tissue, and live tissues, as you know, give off gases.
Right.
It's like but like anything else, like in the body, we eat something and then our body breaks it down and there's off-gassing. Well, there's off-gassing as well within the joint space. And when there's a buildup of that gas and you twist it just a little bit, it pops, just almost like you would, hear a popping from champagne because the buildup of the gases inside.
Ah, interesting.
So it's not, it's not bone on bone. It's not, as you know, there's many things between the two bone structures. It's not two bones rubbing together. So typically you have the inner membrane of the synovial joint. It's called the synovial fluid that is what's created that contains the oxygen and the nitrogen and carbon gases. And it's a ultrafiltrate from plasma, and it contains proteins and things like hyaluronic acid and lubricant that are produced by the cells within the joint tissue. And this is what helps to lubricate the joints. And typically the synovial fluid is what is lost later in life when you have almost like bone-on-bone arthritic condition.
Wow.
Yeah.
So even with arthritis, it's okay to get adjusted despite the decay and the breakdown of the joint.
It is, because not every joint is, what you see on x-ray may look like it's bone on bone, but most of the time there's still some fluid in there. So basically, if there's any kind of motion available, you want to maintain motion. So as a chiropractor, vitalistic, movement is life. Things that live move. So that goes for all the individual joints in the body and the blood and your circulation and lymphatic circulation. And you want to keep everything moving, because anything that goes stagnant or doesn't move just creates almost like dirty water.
And dies.
Yeah. So movement's life, and that's the way we look at it. If you get to a point where there's an arthritic condition where it's like osteoarthritis, where there's a limitation of matter, where now the body has fused itself so it cannot move, those things obviously you don't want to move. You just want to work the joints above and below.
Wow. So basically, to sum that all up, from the day we're born, post-pregnancy to basically the day we die, we should all find a good chiropractor and get adjusted regularly, not just wait till we're broken and then find your magic, right?
Exactly. We should all be moving. And if you can't move, on a typical basis, like people should be able to move all their, should be moving. They should be in motion. You should be exercising. You should be stretching. You should be lengthening your muscles. You should be moving the tissue. You should be unlocking locked joints. You should be looking for knots in your body and removing the knots. And that creates circulation and movement and life. And, and when you don't, you're moving more towards, I hate to say it, but death.
Right.
So, yeah, we want to keep things going as long as we can. So
you treat across the lifespan, across many systems as a chiropractor, including in the ER or in the hospital there. So some of the myths, that the traditional medical minds have said about chiropractic or even physical therapy or rehab in general, definitely seem to be myths and false misinformation, I guess.
I think it's totally misinformation. I don't like all the hands-on healing arts like physical therapy, chiropractic, any of the assisted stretching, the cupping and the myofascial work, and yoga and Pilates, any of these systems of lengthening and just knowing and creating motion and room in the space in the body are all should be used. I think the myths come about when there's just like almost like politics, when there's fear that one is going to overtake another, and then you get people getting territorial.
Yeah, they get worried about their money. Who's going to do better? And ego comes into play a lot.
So when you're talking about, it's like the best centers, I think, or the best practitioners are the ones that will refer to multiple different types of specialties that will help the patients get the best that they can get for their injury.
Right.
Not just the patients locked up to their own thing so that they get all the money. They usually use up the money and then they'll send it to the next specialty instead of, concurrently treating.
Right.
And a lot of that has to do with the insurance companies and what the insurance companies, how they'll cover and how they'll cost. But on the whole, people should be doing as many things as they possibly can in order to increase circulation. And I'm talking even like infrared technology, which will create tissue movement, the cryotherapy, which helps with the hot and the cold. So, people should be getting all kinds of treatment.
Well, that's the thing, I think, as we educate our patients, ourselves, and our followers and believers, the power of these technology and these modalities that have been around for thousands of years, from Chinese medicine to chiropractic to more modern, like cold lasers and heat therapies, seems to be the way of the future. And the health is our new wealth, as we've learned during COVID. And the truth of the matter is, people will be paying out of pocket, and will be paying a lot of money out of pocket for this. And if you don't, then you can stay with sick care instead of health care, which is not what you and I believe in, I don't think.
No, I totally don't believe in that. Right.
So, we know the power of IVs and this cryotherapy, and I think it's really exciting. And again, I appreciate your continuation of learning and giving us these tools and the power, and referring to the appropriate experts and healers that I think we all have a little capacity and power to do to help our patients at the end of the day. I think, again, if we pay it forward and we do what we're good at and stay in our respective lanes, and find somebody where we can work as a team for the patient, that's going to be the best outcomes. And we've had a tremendous success in the past. And hopefully in the future we could get back together and bring that forward again.
Yes, I totally agree.
So to sum it up, it sounds like the crack is good from the day you're born to the day we die. The cavitation or the release of an air pocket, there doesn't seem to be many contraindications or anything wrong with it. And again, even myself, despite working in the world, have not been a good patient in maintaining with my adjustments. So I'll definitely be sure to get adjusted more regularly, and also for my kids, more importantly. I've been trying to adjust and educate my wife, who's also a physical therapist, to the importance of good chiropractic care and for our kids going forward. So thanks again for what you do for the community, your patients, and your clients there.
And then one last thing about the crack. I always tell people when they come in, they say, I moved and I heard something pop. I always say to them, did it hurt? Or did it feel fine? And when they say it felt fine, then I say, well, then there's nothing to worry about. Typically, if you get a bad crack, you're going to know it. It's crack, move, lock up, and you're going to be in pain. So don't be afraid if you get little popping noises in the joint. And it's very common during things like yoga and stretching to get popping, and that's just realignment of your spine and that you're being released in the synovial joint.
So it's been a total myth, basically, wives' tale, that cracking your knuckles, cracking your neck, cracking your back is not true. The evidence suggests the other, actually, is that it is good to adjust and crack our, joints if we have to.
Yes, the one thing that is, I have to say, I tell people to watch out for is you don't want to be chronically readjusting your neck or one area of your body. Some people are habitual, and what happens with that is they can create an almost like a hypermobility, which is not good. You don't want hypermobility. You don't want it moving too little. And you don't want hypermobility where it's moving too much.
You want it just right.
Right, you want just right, because when you adjust over and over and over, and I'm talking about, I see people do it like multiple times a day to themselves.
Oh.
What create is a hypermobility and then a looseness of those vertebrae, and then you feel like you're chronically out of alignment, and you feel like you have to fit back in.
So
and
ultimately, the combination of like where you do your magic, and then when they strengthen or move or stabilize, then that's the glue that holds your great work together.
Right. So we love to have people, we put them in alignment, make sure we get those joints in motion, and then I pray and I try to get them to do either physical therapy or to exercise in order to stabilize around the area.
Got it. Okay, that's easy enough. That's a nice way to kind of sum it up. All right, yeah, sounds good. And I know you're very busy, and I appreciate your time. So that's about our 15-minute little window. Looking forward to podcasting going forward and just talking shop. So thanks for your time, and I appreciate it and look forward to getting on your podcast soon.
Take care.
Thanks, Dr. Kim.
Bye. Have a good day.
You too. Bye-bye.